Dry cough, causes and prevention. Coughing is a natural reflex for clearing the throat and lungs of irritants. While an occasional dry cough is rarely a cause for concern, persistent coughing can indicate an underlying medical condition that may be more serious. A dry cough, or sometimes a tickly cough, is a cough that does not bring up any phlegm or mucus. Dry coughs may cause a tickling sensation and are often due to irritation in the throat. Doctors often refer to dry coughs as non-productive coughs. In contrast, a wet or productive cough brings up phlegm that helps clear the airways of irritants. Doctors also classify coughs as either acute or chronic. A cough is chronic if it lasts longer than 8 weeks. Asthma. Asthma is a long-term lung condition that leads to inflammation and narrowing of the airways in the lungs. One of the most common symptoms of asthma is coughing, which is often worse at night or early in the morning when a person first wakes up. The cough is often productive, meaning it brings up phlegm. However, in a type of asthma called cough variant asthma, the main symptom people experience is a dry cough. Other symptoms of asthma can include wheezing, shortness of breath, chest tightness, or pain. Treatment. There is currently no cure for asthma, so treatment focuses on relieving symptoms and preventing future attacks. Typically, doctors prescribe the following treatments for people with asthma: a quick relief inhaler for treating symptoms when they flare up, long-term medications such as a low-dose corticosteroid inhaler for reducing inflammation and preventing future attack. Idiopathic pulmonary fibrosis, or IPF, is a condition in which scar tissue develops inside a person's lungs. As the scar tissue thickens, it makes breathing in air increasingly difficult. The term idiopathic means that doctors do not know exactly what causes the condition. One of the most common symptoms of idiopathic pulmonary fibrosis is a persistent dry cough. Other symptoms can include shortness of breath, loss of appetite and gradual weight loss, fatigue, clubbing or widening and rounding of the tips of the fingers and or toes, also affecting the shape of the nails. Treatment. There is currently no cure for idiopathic pulmonary fibrosis, so the aim of treatment is to relieve a person's symptoms and slow disease progression. Treatment options include medications, oxygen therapy, pulmonary rehabilitation, which is a program of exercises, training and support for people with long-term lung conditions, lung transplantation. Gastroesophageal reflux disease, or GERD, is a condition where acid leaks from the stomach back up into the esophagus or food pipe. According to a 2015 review, GERD causes a chronic dry cough in up to 40% of people with the condition. GERD typically also causes a number of gastrointestinal symptoms, which may include heartburn, nausea, vomiting, pain or difficulty when swallowing, bad breath. However, research suggests that up 75% of people with GERD related cough may not experience these gastrointestinal symptoms. This can make it difficult for doctors to diagnose GERD in people with just a chronic dry cough. Treatment. Many people can manage symptoms of GERD through lifestyle changes, such as eating multiple small meals each day instead 3 large meals, limiting or avoiding foods that trigger or worsen symptoms, such as fatty or spicy foods, maintaining a healthful weight, quitting tobacco smoking, reducing or avoiding alcohol intake. Over the counter and prescription medicines may also help relieve or prevent symptoms. Postnasal drip. Postnasal drip is when mucus from the nose and sinuses drips down the back of the throat. When the mucus drips into the throat, it can trigger a cough. Although this cough is often productive, it can sometimes also be dry. Postnasal drip often occurs with a sinus infection or due to a nasal allergy such as hay fever. Other symptoms of postnasal drip may include runny nose, a feeling of something in the back of the throat, sore throat, frequent swallowing. Treatment. Treatment options for postnasal drip includes decongestants, nasal sprays and nasal saline irrigation. Upper respiratory infections. Upper respiratory infections such as common colds and the flu can cause acute coughing. The cough often starts out productive but may become dry as a person recovers from the infections. Other symptoms of upper respiratory infections may include fever, muscle aches, runny nose, sore throat. Treatment. A person can usually treat viral upper respiratory infections at home with plenty of rest, staying properly hydrated, and taking over-the-counter medications to relieve aches and fever. A doctor may prescribe an antiviral medication for people with the flu. Lung cancer. A chronic dry cough can sometimes be a symptom of lung cancer. However, other causes of dry cough are far more common. Symptoms of lung cancer can include coughing up blood or phlegm that contains blood, chest pain that may get worse with breathing or coughing, weight loss, shortness of breath, fatigue, feeling weak. Treatment. Treatment depends on the type and stage of the lung cancer. Early diagnosis and treatment can significantly improve a person's outlook. Treatment options can include surgery, chemotherapy, and radiation therapy. Other causes of a dry cough can include cigarette smoking, prolonged exposure to pollution, dust, and irritating chemicals, allergies, some medications. Prevention tips. It is not always possible to prevent a dry cough. However, tips that can help include avoiding tobacco smoke, drinking plenty of water, using a humidifier to moisten the air, allergy-proofing the bedroom to reduce irritants. People with dry coughs that get worse do not go away or cause one to start producing blood or green mucus should see a doctor. It is also advisable for a person to see a doctor if a dry cough occurs along with any of the following symptoms: wheezing, a feeling of something being stuck in the throat, shortness of breath or difficulty breathing, trouble swallowing.